Okay, so what is autism? To get a diagnosis of autism, you have to have impairments in 3 areas. You have to have impairments in communication, impairments in social interaction, and repetitive behaviors or a restricted range of interests. So that's around what the diagnosis is made, is those 3 areas. And when a diagnosis is made using the DSM-5, you need to have a certain number of key points in each of those areas to be considered in the range of autism. And you can see on the slide, too, that talks about the autism spectrum disorder, how these are all interlinking and they all kind of impact each other as well. In Area 1, impairment of communication, what does that look like? A child may have limited to no verbal language. They lack the use of gestures. They may also lack the ability to understand gestures. They lack the coordination of nonverbal communication, which means, the gesturing we do while we're speaking, that type of thing. And they have sometimes unusual prosody, and prosody means like the tone or the pitch of our speech. So when you ask a question like, do you want to go to the beach? Our voice naturally goes up at the end. A child with autism will say, do you want to go to the beach? And it's a straight, flat kind of intonation across the whole thing. So that would be something that would be hard. Sometimes they have irregular rhythm, or they have an unusual voice quality, any kind of odd intonation, these type of things we see. They have a lack of appropriate eye gaze. This is for social interaction section. They have a lack of appropriate eye gaze. It's not that they don't have eye gaze. They do. But it's not well coordinated with their ability to interact with people. So we call that like using both your eyes and your communicative intent. That's the way to say it, is that they have an intention to communicate with their eyes and also with their voice or gestures. So I work with many, many kids who have wonderful eye contact. So this is not always the case, but it might not, be well coordinated, or there might be other issues with it. In social interactions, lack of warm, joyful expressions directed towards others. This is another thing, is like, I remember a long time ago, I would hear people say, well, individuals with autism, they're not affectionate, they're not loving, they're not connected, All the kids I worked with were connected. You just had to look and observe the way that they were trying to connect, So but their joyful expressions and stuff you might see happen more frequently when they're playing by themselves or on their own, laughing and giggling off to the side over something that they're thinking about. They're not sharing that with anybody else. They're just enjoying that for themselves. They may have a lack of response to their own name, unless, of course, they hear, that you're having ice cream or something, and all of a sudden they hear their name every single time. The next area is repetitive behaviors and restricted interests. Kids can do repetitive movements with objects. Sometimes they can put something up by their face and look at it with their eyes and look at it from the side. They can do repetitive movements or posturing of their body. I've seen kids do flicking with their fingers and stuff like that. A lot of visual stims, sometimes even flapping their hands in front of their eyes. Any type of repetitive movement of this sort. And they also could have a restricted range of interests. But a child with autism will most likely stay with the same thing for a pretty long time. So you'll see that range of interest is not to explore. It's not to explore beyond the things that they find initially interesting. An interesting thing, too, that's happened in the DSM-5 is that we used to have many different types of disorders under the umbrella of autism spectrum disorders, which was autistic disorder, which was classic autism, and then Asperger's disorder, which was autism but with no language delay and usually an intact intellect. Childhood degenerative disorder, which is very rare, rest disorder, and then PDD-NOS, or pervasive developmental disorder not otherwise specified. And what that meant is you have autism, but you probably have autism, but you don't have enough of the criteria to have the full diagnosis. Well, now in DSM-5, they decided, they came to the conclusion that there was too much overlap, or there was nothing distinct about each of those things. So it's all become autism spectrum disorder. And there's, interesting things about that, and there's been interesting debate about that, and there's always revisions made and everything. There's been some effects with people with Asperger's not liking that fact that they lost that kind of distinction. And then on the other side, it ensures that more kids get services when they need it. So good and bad things. Some things you should know about autism too is it's no racial, ethnic, or social boundaries, isn't different for family income, lifestyle, or education levels, nothing of that sort. Basically can affect any child anywhere, around the world. So another thing you should know about autism is that it's 4 times more likely to occur in boys rather than girls. So some of the latest autism facts. The new rates were just announced by the CDC last week. 1 child in 68 is now affected by autism. It's just so hard to know that. The prevalence rate has increased by 30% in just the last 2 years. That means that there's a lot we got to figure out as to why this is happening and increasing. We do know some of the reason it is, but it's definitely increasing at an alarming rate. So one of the things that parents and grandparents often ask about this is, what caused this? How did this happen? Why did this happen? Or what was the cause? What made this happen to our grandchild? Presently, there's no known single cause for autism. It's likely that there won't be one single cause. There's going to be many factors that created the presentation of autism. Another really important thing to know is that autism is not caused by bad parenting. I've been out in public with families when I've seen parents go, "Why don't you handle your kid?" Or "Why don't you get your kid to calm down?" And they look at the parent like scornfully, like, "How can you be a parent like that?" It's so hard. It's like so hard to watch. And I've watched parents handle that with such dignity and grace, and be like, "I'm working on it," and then focusing on their kid. So it's really important to realize that, because even sometimes moms, especially, when they have time on their own, they think about things. They think it's somehow their fault, and or the dad somehow thinks it's his fault. And people have different reactions when they hear this diagnosis. One of the other things that I get asked about all the time is autism caused by vaccines. The newest research shows that autism is happening in utero, during when the baby's in the tummy. So it can't really be vaccines, because whatever's happening to the brain has already happened. I think that having something to blame focuses on being that rather than what the child needs right now. It's important to know what the causes of autism, definitely, but you have a life right here, right now, that needs attention and support and help. So it's better to focus on that than to try to figure out, how did this happen. I did put in here, you'll see there's a slide with a link to the study from the Science Daily. It was March 14th that this study came out about the brain development during being in the in utero phase. And there's a little bit of a little summary right there of what they found. It says, researchers have published a study that gives clear and direct new evidence that autism begins during pregnancy. The researchers analyzed 25 genes in post-mortem brain tissue of children with and without autism. These included genes that serve as biomarkers for brain cell types in different layers of the cortex, genes implicated in autism, and several control genes. So that's the latest. Autism may also involve inflammation in the central nervous system. In 2012, there was a study that looked at low levels of an antioxidant with signs of inflammation and cell damage in brains affected by autism. Now, even though I love talking about the stuff, I'm not really sure what that means. All I know is that there's something happening with the central nervous system. And I actually, a few years ago, I got to see Dr. Kirchesney speak. He's at the San Diego Center for Excellence in Autism, and he said it during the talk, it's almost like the brain is having an allergic reaction, or not allergic, but like a protective reaction to an infection. That's kind of what it seems like, because what's happening is that the brain cells start to fight with each other about, like, we need to create more neurons, and then the other one's going, we're creating too many neurons, we got to kill the neurons. So they're like having a war in the brain in response to some kind of, for some reason, they don't know. There also may be a genetic environmental interaction effect. And what that means basically is that, if you have genetic predisposition for cancer, because you have 3 family members in your family that had it, you have a higher or increased risk of having cancer. That's because the potential for the cancer to occur is there, it's present. And then the environmental factors kick in, and the two of them intertwined, have an effect on each other and an impact. They're thinking that this, toxins in our environment, prenatal exposure to chemicals, these type of things are being linked to autism. Important thing to know too is that not a single one of your grandchildren is like any other grandchild in this room. They all have strengths, they all have weaknesses, they're all affected differently by their disorder. It's called a spectrum disorder because of that. No child is affected the same way. The disorder can range from very mild and almost not noticeable unless maybe you know what to look for, to extremely severe, depending on how the brain has been affected. Dr. Fine at UConn explained it to us one time. If you can think that your brain is like a bush, a bush in the garden, right? And it's got all the leaves all around it, and then there's pockets where there's no leaves. So part of it's flourishing and other parts have been affected. And so it can be affected differently in every single child's brain. And that's why some kids can talk, some kids can't talk, some kids have stereotypies, some kids don't. It's different areas of the brain that are being affected differently. So that's why it's called a spectrum disorder. I say that also because you're going to get a lot of advice from people about what to do. Just be careful because their child is not your grandchild. So it might not be applicable to them. And just be cautious of that. The parts of the brains that are affected by autism, you can see the different areas, and if that area is affected, what that affects in terms of behavior. So, for instance, the amygdala, it says this is responsible for all emotional responses, including aggressive behavior. The hippocampus, this makes it possible to remember new information and recent events. So if a child has difficulty with remembering things they were just taught, possibly that could be the part of the brain that's been affected or impacted. And the reason I bring this up, and I'll probably say it again and again, is that to know that your grandchild is not doing things willfully because they're trying to, be disobedient, or that they're tantruming on purpose for some reason because they, want something. Reacting to the diagnosis. I know some people here just recently had a diagnosis, and the fact that you're here today and you're out and addressing it is just amazingly wonderful. So a lot of people put their head in the sand and don't address it, and we know how important early intervention is. So the fact that you're here for your grandchild is really amazing. So thank you for being here. It's all kinds of different kinds of reactions that you could have to hearing the diagnosis. So you might be angry about it, this comes from their side of the family, not our side of the family. Or something like that. Or confusion. I'm overwhelmed by all this new information. You'll probably leave today here feeling a little overwhelmed because I'm presenting a lot of information to you guys. So it's a lot to take in. So you might have some confusion about what to do or where to start. There's also sometimes denial. This cannot be happening in my family. He doesn't have autism. He's just, he's just really smart or something. One time I was talking to this mom who I was showing her that she didn't think her son had autism. He'd already been diagnosed, but she was in denial about the diagnosis. And he was walking on his tiptoes around the table and stuff like that. And I'm like, this is called toe walking. Your son is walking his toes. It's one of the signs of autism. She's like, he's just curious. He's just curious. He just wants to see what's on the table. So anything that I would say to her, she was in that stage of denial and she didn't want to hear it. She wasn't ready to hear it. There also might be a stage of disappointment. Will I be able to have a relationship with my grandchild? Also disappointment, and this happens a lot for your children. Anytime there's a major life event happening, it's almost like they grieve again for the loss of that activity. Fear is a big one too. What will happen to my grandchild when I'm no longer here to help? That's the fear stage. Fear of also about what is their life going to be like? Are they going to be able to get married? Are they going to have friends? What kind of life are they going to have? So those kind of fears are totally common too. And then we also have guilt. Did I do something to cause this? Should I have helped my daughter more during her pregnancy? Any kind of thing where you feel like I could have done something. Maybe if I had done something different, this would be different. That's a common reaction too. And then there's also powerlessness. I wish I could change this. I wish I didn't have to deal with it. I wish this wasn't our family's problem or our family's issue or challenge. I just don't know, how we're going to get through this. It's a very common feeling too. It's important to know that each person responds to the news of an autism diagnosis in a very personal manner. You may be concerned for your son or daughter and their spouse, worried about how they are coping, and unsure of how to best help. You probably have many questions, and it may take time to find out those answers. You will have to find a starting place to adapt to the diagnosis and thrive as a grandparent of a child with autism. So most grandparents are shocked when they hear that their grandchild has autism. And again, we went over, you would have all these different emotions you may be feeling, and just know that those feelings are natural and that you're going to get through them. You're going to go through a brief period of mourning perhaps, very similar to that of your adult children.